Very good morning and warm greetings. This is Dr. P. Adilakshmi, Chairman, Women's Cell of Prasad V. Potluri, Siddhartha Institute of Technology. Welcome you to today's webinar on wellness and hygiene. Wellness and hygiene occupy a very important part in the present day context. Everybody should recognize the importance of leading a happy life. Wellness is an active process of becoming aware of and making choice toward a healthy and fulfilling life. Wellness is more than being free from illness. It is a dynamic process of change and growth. It is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Today, we have with us a very competent, young and dynamic doctors to share their insights about how to prevent loss of hair and menstrual hygiene. Dr. Jagadish, MD General Medicine, Dr. Harshavina, MD Radiology, are with us. I thank on behalf of Women's Cell, Prasad V. Potluri, Siddhartha Institute of Technology, both of them for accepting our request to be the resource persons of our webinar on wellness and hygiene. We thank our management, our beloved principal, Dr. K. Sivaji Babu Garu, for supporting us, our activities. I also thank all the participants for attending this webinar. Now my colleague, Mrs. Krishnasri, will formally introduce our resource persons. Thank you. Stay safe and stay healthy every day. Thank you very much.
Yeah, good morning all. A warm and hearty welcome to all the participants of the webinar. In olden days, people used to say Vaidyo Narayano Hari. It means doctor is next to God. This is undoubtedly true, as we all have witnessed during this pandemic situation. The role and importance of doctors across the world and their contribution in protecting mankind is beyond comparison. On this note, I am pleased to welcome Dr. Harshavina and Dr. Jagadish Polavarapu to the webinar on wellness and hygiene. It's my privilege to introduce the renowned doctors and trained experts in radiology and general medicine. Dr. Veena has completed her medicine in 2014 and master's in radiology in 2018 from the prestigious Usmania Medical College. Currently, she is working as a senior resident doctor at Usmania General Hospital and the consultant at Vijaya Diagnostics, Hyderabad. Dr. Jagadish Polavarapu has graduated in medicine in the year 2015 and master's in general medicine in 2019 from the prestigious Usmania Medical College. He is eagerly waiting to pursue his further studies and research to achieve a super specialty degree, that is Doctor of Medicine in Gastroenterology. Let's recollect Dr. Abdul Kalam's quotation: confidence and hard work is the best medicine to kill disease called failure. This is very true in the case of our doctors, as they have done their masters in the best medical subjects, that is radiology and general medicine. Dr. Veena and Jagadish are very studious, hardworking, and have proved their zeal and dedication by getting the top branches in the prestigious university. We are very fortunate to have them here to deliver the lecture. Now I request the doctor to take over the session. Thank you.
Thank you, ma'am. Thank you for introducing us. Hi guys, good morning. Hope you are doing good. As a general medicine doctor, I get to meet a lot of people coming with complaints of hair fall. So I thought when I was given this opportunity, I'll talk a little bit about hair fall and give a brief insight into the treatment remedies. And at the outset, I want to thank Dr. Shivaji Babu Garu, the principal, and Dr. P. Adlakshmi Garu, the director of wellness, the director of the webinar, for giving me this wonderful opportunity. Okay. And without wasting much time, I'll go into the topic. Is the screen visible, madam? Is the screen visible, madam? Hair fall and
Screen is visible, sir. Sir, you can go ahead.
I'm going. Okay. So coming to my topic, it's hair fall and remedies to prevent it. Okay. Oh my God! Look at this woman. She's so scared with the hair on the comb. Even we'll be that condition. Okay, we'll go to the top. Hair. What is hair? Hair is nothing but a protein structure that grows on the human skin, except the palms and soles. Hair follicles develop into new hair cells, which produce a protein keratin from which the hair develops. As the hair grows old, it is pushed out of the skin and eventually leads to hair loss. Average on a day, 100 to 150 hair falls fall every day. If it's more than 150, it is significant. So not all the hair that falls is significant. Normally, 80 to 100 hair follicles wither off every day. Okay, the hair fall, if it's more than 100 or 150, it is significant. Coming to the stages of hair follicle development, hair follicle develops in three stages: Anagen stage, Catagen stage, and Telogen stage. It can be remembered as ACT: Anagen, Catagen, Telogen. Anagen is the active hair growth stage. See in the image, the hair is growing. This is the active stage. It lasts for around 2 to 6 years. And 90% of the normal scalp hair is in the Anagen phase. After the Anagen phase, it goes into the Catagen phase. This is a brief transition phase in which the hair stops growing actively. And only 2 to 3% of the scalp hair is in the Catagen phase. After this, it goes into the shedding phase called telogen phase. See, the hair follicle is thin and ready to fall off. 10% of our hair, scalp hair is in the telogen phase. So this is the hair that is falling off every day. Like I told you, 80 to 100 follicles fall off every day. That is from the telogen phase. After the telogen phase, the hair falls off and again, new hair follicles develop. This is again the anagen phase. The cycle repeats: anagen phase, catagen phase, and telogen phase. ACT. Okay. So what is hair fall? Hair fall is nothing but the loss of hair. Medically, we call this as alopecia. There are many types of hair fall with different symptoms and causes. What are the causes of hair fall? What are types of we'll go on types of hair fall. The first and foremost, it is involution alopecia. It is nothing but a natural condition that occurs with aging. As the age increases, the hair gradually thins out and it falls off. Alopecia areata is one more autoimmune disease in which there is sudden onset of patchy hair loss. It occurs in children and young adults. It may eventually lead to complete baldness called alopecia totalis. But in 90% of these patients, hair recovers with treatment. Alopecia universalis. It is a condition in which the entire hair of the body falls off, even the eyebrows, eyelashes, and the pubic hair. We'll go into the images. See, both these images are alopecia areata. We see that there is patchy hair loss, right? Here, both the hairs. And below, we see the images of alopecia totalis, alopecia universalis. We cannot see even the eyebrows and eyelashes of this kid, right? This is alopecia universalis and this is alopecia areata. Both these conditions are treatable. With treating, 90% regain their hair. And trichotillomania. Trichon in Greek means hair. Mania is a psychiatric condition. It is generally seen in psychiatric patients in which the patient tries to pull up their own hair. It is seen in children also. And telogen effluvium. It is a temporary hair thinning condition of the scalp. It occurs due to the changes in the hair cycle. Normally, as I told you, 90% of the hair of the scalp is in anagen phase, right? But in telogen effluvium, most of the hair is in telogen phase. So it is thin and it falls off frequently. This commonly occurs in chemotherapy patients. Androgen alopecia. This is the most common condition causing hair fall. Androgenic alopecia, as the name implies, androgens are responsible for the hair fall. And as you know that in males, the predominant sex hormones are androgens, mainly testosterone. In females, the sex hormones are estrogen and progesterone. But females also produce little bit of androgens, but it occurs eventually in the later part of their age. In the males, this is like I'll show you from here. It starts from the frontal region and slowly the hair recedes and eventually the crown is also affected. See, this is the last stage. As it grows, it leads to the last stage in which the entire scalp is free of hair. You can remember this is Katapa. And in females, it is a little rare condition. We see it only in 15% of the females. In males, it is a more common condition. By the age of 60, we see 70% people suffering with male pattern baldness. Coming to female pattern baldness, I told you in the early ages, estrogen and progesterone are the predominant hormones in females. With the age, they reach menopausal by 40s or late 40s. Then the estrogen progesterone action decreases and the androgens predominate. During this time, the hair thins and leads to hair fall. The only difference between the male and female is that in the females, it starts in the crown region, not from the frontal region. Here it is receding from here, right? But in the females, it is receding at the front crown region, and it gradually progresses and leads to loss of hair on the crown. So the androgen alopecia is the most common cause of alopecia. So most of the medical management for the hair fall is based on preventing the androgens from acting. We'll talk about the androgen treatment later in the part. What are the causes of hair fall? Hair fall is due to many causes like hormonal imbalances, genes, stress, illness, childbirth, drugs, cosmetic procedures, autoimmune disease, and burns, injuries, and x-rays. Hormones, as I told you, abnormal levels of androgen is the most common cause of hair fall. These hormonal changes are common in puberty, pregnancy, and menopausal women. Genes. Genes is that which we inherit from our parents. Both male and female parents are responsible for this genetic imbalance. Genetic causes of hair fall cannot be treated with any treatment. They should only go for transplantation because that is genetically predisposed. Stress, illness, and childbirth. Various stressful conditions lead to hair fall, like various diseases and hormonal imbalances like thyroid disease and iron deficiency anemia. Various infections like ringworm infection and dandruff cause hair fall. Dandruff is the most common condition we see, and in humid regions like our coastal places, we see a lot of dandruff causing hair fall. And childbirth is one of the common causes of hair fall. After childbirth, it's called postpartum period. In this postpartum period, women have a lot of hormonal imbalance due to which they lose a lot of hair. This is the common condition we see in clinic practices. And drugs. Many chemotherapy drugs commonly cause the telogen effluvium, which I told earlier, leads to hair fall. So we see cancer patients with a lot of hair fall. And few antihypertensive drugs and birth control pills also cause hair fall. Burns, injuries, and x-rays. All these cause temporary loss of hair, and this hair gets back to normal once the injury heals. Autoimmune diseases are health conditions, which I told earlier, like the alopecia areata, in which the hair is patchy, lost in a patchy way. But even this is treatable, and 90% of the hair get back to normal. Cosmetic procedures. Shampooing too often, bleaching, and dyeing of hair can contribute to hair thinning. These cause permanent hair damage. So when do we call it hair fall? Not all the hair that falls is hair fall. As I told you, normally 80 to 100 hair falls off every day. And many people complain that I'm losing a lot of hair when I'm bathing, or when I wake up, I see a lot of my hair on the pillow. That's not hair fall actually. It should be counted. The daily hair count is a method to signify if it's the hair fall is significant, should be treated or not. Okay, as I told you, 80 to 100 normally falls off. Only if it's more than 100 or 150, it is significant. And after shampoo bathing, it should be more than 250 to be significant. Up to 200 or 250 is normal. There are many other tests to diagnose hair fall, like the pluck test. They pluck the hair and test it, pull test, and scalp biopsy, which we do in alopecia areata. These are all done by dermatologists. Okay. Your hair is your crown, you never take off. Hair is like the God-gifted crown here. You should protect it. We should do all the measures to protect our hair. So how do we prevent hair fall? First and foremost, we should eat a nutritionally balanced diet. Just like our body requires many nutrients for our growth, hair is also essentially a keratin protein. So even it requires food for its well-being. So we should eat a nutritionally balanced diet. Avoid tight hairstyles, braids, or ponytails. Avoid compulsive twisting, rubbing, or pulling your hair. Treat your hair gently when washing and brushing. A wide comb may help to prevent pulling out of hair. And hair wash is very important. Wash at least twice a week because it removes the dirt and cleanses the hair. Avoid combing the hair in wet conditions. Avoid harsh treatments like hot rollers, curling, and irons. See the young lady over here trying to curl her hair, and this lady is ironing her hair, and this is blow drying her hair. They're looking good, but you should try to avoid them. I cannot even stop my wife from getting all this done at the parlor, but I'm saying Try not to do it more often. You can do it occasionally, like once in festivals or your occasions. Okay. Dyeing is damaging. Dyeing looks good, it's trendy, but it should be avoided because it leads to permanent hair thinning. This lady over here bleached her hair. See this? It is good, but it should be avoided on long-term basis. Okay. Dyeing and all the parlor activities should be limited. And all these shampoos, these are all what we see in the TV commercials, right? The Dove, Pantene, Sunsilk, Head and Shoulders. All these contain a lot of chemicals. They have to be avoided. So this doctor is saying not to go to the parlor or not to buy any shampoo. What's it? I'll suggest you a brief note into the shampoos to buy. Before buying a shampoo, just check the ingredients of the shampoos, the parabens, sulfates, and fragrance on the shampoos. All these are harmful for the hair. The parabens are carcinogenic and lead to later on breast cancer and all, hyaluronic and sodium lauryl sulfate. All these ingredients should be avoided. So before buying a shampoo, you should check the ingredients and you should buy shampoos which are paraben and sulfate free. Nowadays, they're easily available in the Amazon or any other shopping portal, or you can buy it from the medical shop itself. If you don't want to complicate on the shampoos, go for the age-old remedies like the soap nuts, like what we call in Telugu kunkudukai or amla or shikakai. These are healthy age-old remedies which were practiced earlier. So that's the reason our early generation used to have a longer and thick hair, which we started using shampoos with a lot of chemicals and destroyed ultimately. Go with the shampoos without parabens or sulfates, or try using the natural ways. Okay. And what are the remedies for hair loss? Oil massage, which we used to do in olden days, is a very good remedy. Massage your hair with lukewarm hair oil and lightly apply pressure with the fingertips. Do it at least once a week. You can also use Indian gooseberry, amla, for nourishing your hair. Amla is rich in vitamin C, which is essential for the hair growth. And eating an amla a day is also very good because the vitamin C absorbed in the intestines help in absorbing the iron. Iron is also required for the hair fall. So, eating an amla a day as well as applying amla once in a week. And aloe vera gel. Aloe vera gel applying to the scalp acts like a natural conditioner. It balances the pH of the scalp and maintains a healthy hair. Fenugreek, what we call mentlu in Telugu, the fenugreek powder, you can apply it as a scalp paste and leave it overnight. This is very healthy for the hair, as well onion juice or coconut milk and beetroot. These are all very good for the hair loss. What are the oils to be used? Normally, we go with coconut oil. This is a commonly available thing, and we can use it at least once in a week. And this is the castor seeds, right? We call amadam oil. This is little thick in consistency, but even this is good. And this is argan oil, ava nune we say. All these are very good for our healthy hair. We should at least massage once in a week with this oil and wash our hair with safe shampoos or any natural remedies. Okay. You should brush with your fingertips or at least use this scalp brush, which is commonly available in the market. This we see in a lot of shops, right? Even this is useful for massaging the hair after applying oil. So you have tried all these remedies, but still you're not able to find out what is the cause of your hair fall. So this is the time you have to visit the doctor. Most commonly, we see young women coming with polycystic ovarian syndrome as the cause of hair. They usually present with high acne on the hair, pimples on the face, irregular menstrual cycles, and hair on the face, and a lot of hair loss. They usually come with overweight also. So this is the condition where we have to check the hormone levels, and we find high testosterone levels in these conditions. They should be treated by doctors. And one more common condition is a thyroid issue. Either hypothyroidism, in which the patient presents with overweight, dry skin, hair loss, and fatigue, or in a hyperthyroidism condition in which there is excess thyroid causing weight loss, anxiety, moist skin, and again fine brittle hair. Both these conditions are commonly met, and we should be treated by a doctor. And one more common condition we see in the clinical practices is anemia. Iron deficiency anemia is one more common cause of hair loss. So we diagnose the case. So how do we treat the hair fall? It is managed by the diet or medical or surgical management. So what should we eat for a healthy hair? Here on the right side, you see image, the hair food. All these foods are very helpful for the hair fall, preventing the hair fall. Okay. The first and foremost is egg, which we commonly see, and non-vegetarians can have the fish, lemon, fresh green leafy vegetables, walnuts, almonds, banana, and sprouts and oats. All these contain essential vitamins, proteins, fats, and minerals required for hair growth. What are the vitamins required for hair growth? We'll look into it. These 7 vitamins are essential for the hair loss. Vitamin A found in the carrots and beetroot. Vitamin C found in the citrus fruits and lemon. The biotin, vitamin B7 found in the eggs and meat. Vitamin E found in almonds and papaya. Vitamin D found in the fish and oats. And folate found in the beetroot. And vitamin B12 found in the milk, cheese, and eggs. Among all the 7 vitamins, the vitamin B7 biotin is the most required for the hair fall. So that's the reason we see a lot of health hair supplements having biotin. See all the 3 different brands are giving biotin. So among all the 7, you have to remember that biotin is essential for hair fall. Okay, you should try to eat it naturally, or at least try using a biotin supplement. And this is the medical management for hair fall. As I told you, hair fall is essentially because of the androgens. So the treatment targets at preventing the action of androgens. Okay, 5-alpha reductase inhibitors or topical hair sprays or anti-androgens. They directly prevent androgens from acting, like ketoconazole, spironolactone, and flutamide. What is this 5-alpha reductase inhibitors? I'll show you. Normally, the testosterone in the body is converted into 5-dihydrotestosterone. It is by the action of 5-alpha reductase enzyme. The finasteride acts on the 5-alpha reductase enzyme and stops it from being active. So the testosterone is not converted into 5-DHT. 5-DHT is mainly responsible for the hair fall. The 5-DHT acts on the scalp and causes thinning of the hair and ultimately leads for the hair fall. Okay, this 5-DHT should be prevented. So we use drugs like finasteride or dutasteride or alpha-tediol to prevent conversion of testosterone to 5-DHT. And topical sprays like minoxidil are also very helpful. Minoxidil is basically a vasodilator. That means it dilates the vessels in the scalp. So as a result, there is increased blood flow to the hair, which leads to healthy growth. Okay, finasteride, these tablets on the left, and right side minoxidil spray. You see the before and after effects of minoxidil spray. This is female pattern baldness, you see, and see how the hair has grown in 6 months of treatment. The male pattern baldness also in the crown, and a receding front line is also improved. Minoxidil and finasteride are commonly used nowadays. And one of the common causes of hair fall is dandruff, which we face in this humid environment. This is scaly and itchy hair. See before and after using. These are the common shampoos used for dandruff. Ketoconazole, selenium sulfide, and glycerol, which is commonly marketed nowadays. See how it has cleared all the scales. Dandruff is a very common condition, which I think 50% of us will have, the coastal environment. And coming to platelet-rich plasma therapy, it is a newer therapy which is helpful in preventing the hair fall. This is done by extracting the blood from the patient. 10 ml of the blood is extracted from the patient and it is centrifuged for 10 minutes. After centrifusing, the blood in the test tube separates as red blood cells and plasma rich in platelets. This platelet-rich plasma is extracted from a syringe and injected into the bald area. Why is this given to the bald area? Means this platelet-rich plasma has a lot of platelets. Platelets have platelet-derived growth factors in their granules. These platelet-derived growth factors are essential for maintaining the new hair, and they increase the circulation as well as responsible for maintaining the healthy hair. See the doctor injecting PRPs into this bald areas, and you can see the transformation after 90 days. Normally, a sitting is done once in 2 weeks or 3 weeks. So this is roughly after 10 sittings, I guess. PRPs are increasing nowadays, but there is only a marginal benefit. Like only 20 to 30% patients will have benefit. But why to waste it? We are trying the platelet-rich plasma therapy along with minoxidil and finasteride nowadays. But this is not useful for genetic baldness. As I said earlier, genetic baldness is only treated with hair systems or hair transplantation. All the tablets or this PRP is not useful for genetic baldness and hair system. This is commonly used nowadays. This is nothing but a wig, which we call Telugu Shavaram Anevalam. We used it in olden days, and it has regained now. See the bald person here. The patch is shaved off, and this is the inner side of that. This is a glue, and they attach a system to this. See the transformation here. This is all the synthetic hair follicles. And Katappa, how is this possible? See him in the movie Bahubali and in the next movie. All this transformation is because of the hair system, the synthetic hairs. Hair system maintaining has become common nowadays. It is very simple, and once in a month you just need to service the wig. They just wash the wig and reattach with the glue. So and a simple procedure also. See the amazing transformations here. A young man with complete grade 5 baldness is treated with the hair system, and this guy also. So the final step is hair transplantation. This is a surgical technique and little tedious process. In this hair transplantation, we remove the hair follicles from the body called the donor side to the bald part called the recipient side. It is primarily used to treat male pattern baldness. In this condition, the grafts containing hair follicles that are genetically resistant to balding are transplanted to the bald scalp. See this. The main concept is go down to showroom. The back part of the skull, occipital region, this hair is not visible. So this is called the go down. And the front bald part, this hair is called the showroom. So we essentially transport this hair from the go down to the showroom. They're plucking, you see this, they're harvesting from the donor area and they're planting here. This is the recipient area. See how the look has changed. This is the showroom and this is the go down. So essentially the hair transplantation is nothing but shifting of hair from the go down to showroom. More recently, bioengineered follicles have been successfully transplanted to create histological normal hair follicles. These bioengineered hair follicles are not our hair follicles. They are synthetic fibers which are transplanted into the bald area. But only issue with this bioengineered hair follicles is they don't grow in size. A fixed size should be cut and implanted. This is recently a very expensive thing and will take in the future. So these are few celebrities who have undergone hair transplant. See, Virendra Sheva, and you know this guy, right? He's from CAD, TV serial actor, and Vivek Oberoi. So essentially, hair transplantation is like the last resort. So why should we go for hair transplantation or hair systems when we can maintain it with basic food and healthy habits? Nowadays, hair transplantation is also done for females. This is female pattern baldness, and see the after effects. And here also, see the crown which is covered with the transplanted hair. You know what hurts more than the breakup? Hair fall. You have to face it here. Dear girls, stop worry about your hair fall more than your love. Because love can come again, but your hair won't. So it is our basic thing. And I'll give you a few take-home points. Eat healthy and stay fit. Wash your hair regularly. Always use paraben and sulfate-free shampoos. Know your problem. Diagnose it. Go to a doctor. Invest on your hair. It's a crown, you can't lose it. So it's a God-gifted crown, right? We don't want to lose it. We cannot afford to lose it also. So we should take all the steps to protect our hair because it adds a lot of beauty to our hair. Okay. Healthy eating and exercise gives a perfect skin and healthy hair. Thank you. And one more thing, in this COVID era, you have to be safe. It is your responsibility to protect yourself as well as your family. So always use masks and maintain social distancing and sanitize. Okay. All the best. Thank you.
Yeah, thank you, sir, for the wonderful session. Now I request Dr. Veena Garu to take over the session. And I request all the participants to post their queries in the chat box.
Just okay. So
Am I audible?
Yes, madam, you are audible.
You're able to see my screen?
Yes, madam.
Okay. A very good morning to you all. I'm Dr. Harshavina, and I'm here to discuss a very, very important topic for you guys. That is the menstrual hygiene. Before I begin, I would like to thank Dr. Shivaji Babu Garu, the principal, and Dr. Adi Lakshmi Garu, the webinar director, for giving me this wonderful opportunity. I would also like to thank the madam who introduced us for that lovely introduction. It's very overwhelming. So let's begin. Menstrual hygiene. So I want to discuss my topic under the following headings today. That is the importance of the menstruation, the female reproductive system in brief, the menstrual cycle, what are all the alterations in the menstrual cycle, the premenstrual symptoms, how can we manage the symptoms, what are the period products and options available in the market, how can we dispose these things, and the personal hygiene and menstrual hygiene, how can we track our periods, and India on the international platform. Let's begin. Why is it important at all? Because 52% of the female population is of the reproductive age group. That is, it's more than 1/4 of the world population, which means that all these women will menstruate each month for about 2 to 7 days. So it is very important to have education about menstruation and how to deal with it. Because in most countries, including India, this topic is never talked about. It remains as a taboo, and so it affects the young minds psychologically, emotionally, physically, and that causes a lot of general inequalities and exclusion. A few statistics. Coming to the statistics, 50% of the girls in India, they don't know anything about their period until they start on their own, and only 16% has the access to the sanitary napkins, maybe because of its cost. And 28% of the women and the girls in Indonesia miss their work due to their period. And 60% in Nepal, they avoid social gatherings due to menstruation. And 13% all over the countries, mostly the low and middle income countries, they miss their school due to menstruation. So what can we do? We can provide them some good sanitary facilities and education about the menstruation, menstrual hygiene, and then improve their quality of life and have the access to the literacy and jobs. So coming to the topic, why is it not talked about? Because people think it is very unclean, it's very embarrassing to talk about menstruation. Suppose you take off for your college because you have severe dysmenorrhea or discomfort, and your friend calls you up and asks you why you didn't attend your college, or your teacher or your lecturer calls you up why you didn't come to the college. You don't tell them you have your period. You generally tell them you have a fever or a headache. That's how it generally happens, right? Yeah, but what is the reason? Because we are raised like that. We were told not to discuss about this topic. So break this myth. We'll have to break this myth and talk about it. What are all the common myths followed in India? Just not in India. There are many countries where the girls are treated like this. They are not allowed to attend religious functions or temples, and they are asked not to cook, not to go to schools, colleges, do not touch meals, do not eat certain type of foods, and all these are myths. So very comfortably, if you're comfortable and you don't have any issues or you don't have any dysmenorrhea, don't restrict yourself from doing any of these things. You can go wherever you want, you can do whatever you want, you can eat whatever you want, and never ever postpone anything in your life because you have your period, because it's just a natural process, it's a physiological process. It is that everybody, it's a physiological process which happens in your body, it's not a disease. Okay, so don't ever postpone anything because you have your period. So coming to the female reproductive system, in brief, I would like to tell you. So you have a uterus, one big uterus, and adjacent to that, these two things, tube-like things, are called as fallopian tubes. And this white thing here, you can see the green color thing, is the ovary. You have two ovaries, two fallopian tubes, one on each side, right and left, and then you have a big uterus, and the uterus opens outside through vagina. This is the vagina. So what happens every month? Every month from the ovary, one of the eggs develop. There are multiple eggs in the ovary. One of the egg will develop and it is released. So generally the eggs will be of the size 2 mm, 3 mm. So during your cycle, this 2 mm egg will slowly develop and comes to the size of for about 20 to 25 mm. And once it reaches the appropriate size, it is released outside. Once it is released, it is captured by this fallopian tube. The egg is captured by the ovum is captured by this fallopian tube, and slowly it travels into this fallopian tube. And during this, it generally happens on your 13th to 15th day of your cycle. During this time, if there is intercourse happening and if there's a sperm available, then it will get fertilized in the fallopian tube. Once it is fertilized, it slowly comes down into the uterus, and in the uterus, it gets implanted. And then the pregnancy continues. What if the sperm is not available during that period? Then this blood lining around the in the uterine cavity is no longer required, because it need not support the developing embryo or the fetus. So so the body sends a signal to the uterus saying that it is no longer required. So all this blood sheds out, and it comes out through the body in the form of menstrual blood through the vagina. So that is what our period is. That is what happens every month unless you're pregnant. Okay. So I already explained you. Just want to revise. It is generally the cycle is for about 28 days, but it is not standard. It can last from 21 to 35 days. It can just vary. Some people can have a 21-day cycle. Some people can have a 30 cycle, 32-day cycle. So anything between 21 and 35 is quite normal. Okay, each cycle the egg is released and it moves into the uterus through the fallopian tube, and the tissue and the blood line the walls of the uterus for fertilization. If it is not fertilized, it is shed out in the form of menstrual blood. It generally lasts for about 2 to 7 days. Some people will be having a lighter flow, some people will be having a heavier flow. So it is quite normal. And once you start your menstruation, the first 1 or 2 years, there'll be irregular cycles, and that is also quite normal. So what are the abnormalities in the menstrual cycle? When you'll have to get worried, it is when there is excessive bleeding. Excessive bleeding means it is more than 80 ml at regular intervals, or that is called as menorrhagia. Menorrhagia is something which where your bleeding period is very prolonged, that is for more than 8 days. Menomenorrhagia is both excessive bleeding and prolonged bleeding. Oligomenorrhea is if your cycle interval is for 35 days or more, then it is called as oligomenorrhea. Polymenorrhea if it is less than 21 days. Amenorrhea is complete absence of your menstruation. Suppose you don't get your period for 6 months, then you call it as amenorrhea. What is intermenstrual bleeding? You have your normal periods, but in between your periods, you'll have some slight spotting. So all these conditions are abnormal. So you'll have to go to a doctor if you're having any of these conditions. All right. Amenorrhea. Amenorrhea is complete absence of periods. I already told you. But this amenorrhea is quite normal in few conditions. Like in pregnancy, as I already told you, every cycle the egg will be released. It goes into the fallopian tube. And once it is fertilized, it goes into the uterus and the pregnancy continues. Generally, there is no pregnancy every month, so you'll have your menstrual period. But if there is a pregnancy, if there is a fertilization happening, if there is an implantation happening, the uterus has to support the baby, right? So the blood vessels, the blood supply to the uterus keeps on increasing so as to provide nutrition to the growing baby. So then you will not have your period, because the uterus has to support the blood in the form of increased blood supply and fluid around the baby and all that. Suppose you have your period during a pregnancy, it is abnormal. Okay. And there's something called as lactational amenorrhea. Once you give birth to the baby, you start breastfeeding. Once you're doing breastfeeding, because of the hormones, you will not have your period, and it is also quite normal. And at the time of menarche is a time when you first menstruate, that is called as time of menarche. First time you menstruate, and the next 1 or 2 cycles you might not get your period. It is also quite normal at the time of menarche. And suppose you're starving, you're dieting, you're trying to keep you in shape and everything, your food is severely limited, then also your reproductive system is getting affected, your hormone levels in the body is getting affected, and so you might have amenorrhea. And following menopause, as the name suggests, menopause is complete absence of menstruation. It generally happens in the late 40s and the early 50s. So once the menstruation stops, you call menopause when you don't have your menstruation for about 1 year. That is, for 12 months you don't get your period. That is called as menopause. So you will menstruate every month from menarche, that is a time of menstruation, to menopause, that is a time when the menstruation ceases. That is for a period of about 30 to 35 years. So that is the reproductive age group for the women. Okay. So what is menstruation? This I already discussed. It generally, menarche is the time the menstruation starts, and it is between 10 to 19 years of age. Apart from menstruation, the young girls will also develop some physical changes. That is a time of puberty, pre-pubertal time, or puberty. When they hit their puberty, they have some physical changes in their body, like growing breasts, wider hip, and some body hair, like the axillary hair, pubic hair. All these are quite normal. Don't get scared. Try. You'll have to understand your own body. You'll have to feel proud that you're becoming a woman. So discuss it with your mothers or female friends or teachers when you have any issues. And apart from the physical changes, there will be a lot of emotional changes due to the hormones. Okay, menstruation generally, when after it starts, it continues till the menopause, unless you're pregnant or you're suffering from or lactational amenorrhea or any other conditions which I've already mentioned, the causes of amenorrhea. Okay, this menstruation is called as a menstrual period or menses. That is how we generally address it. So I'm sure most of you have hit your first period, right? So this is what you can do right now is to understand it, and please educate your younger sisters who has not have their first period, or your cousins or your neighbors, small little girls who don't know what their first period is, because I already mentioned about 50% in India, they don't even know what their first period is. So please take this responsibility. It's a request from my end. Please tell them, they have to talk to other girls like their mothers, sisters, aunts, grandmothers, or female friends, or other women, older women in their community. They're all there to help you. Please go and take their advice, ask your doubts, and tell them, please don't get scared, because the first time they see the blood on the underwear, it is very scary. Tell them it's a very natural process, normal process. Tell them, if they're at school and they have their first period, just educate them what they have to do. They have to go discuss it with their teacher or a friend, and then take their help and tell them that they're developing into a young woman. Okay. Now I want to tell you in brief what the menstrual cycle is. I will take 28 days cycle as a standard, and I will explain you. As I already told, 28 is not a standard. It can vary from 21 to 35 days. So anything between that is quite normal. Don't be afraid. Don't think that it is not normal if you have a 30-day cycle or a 22-day cycle. Okay. If you take 28-day cycle as standard, the first 14 days is called as follicular stage. The next 14 days is called as secretory phase or a luteal phase. So what happens in the first 14 days? In the first 14 days, the follicular phase, this egg, this white thing, grayish white thing, is the ovary. From the ovary, there'll be a developing egg. It keeps on increasing its size, becomes matured, and at around 13th to 14th day, it is released. So till then, it is called as a follicular phase. So on 14th day, the egg is released. Here you can see the white egg is in the fallopian tube, that is in the violet color. So this is the ovulatory phase. Ovulatory phase is on 14th, 15th day when the matured egg is released into the fallopian tube. It is called as an ovulatory phase. So once the egg is released, the endometrium gets thickened. The uterine cavity, the blood supply keeps on increasing because it gets ready for the pregnancy. Every cycle, your body gets ready for the pregnancy. Suppose if it is not getting fertilized, if there is no intercourse happening, then this lining is no more required. So what happens? This lining is shed out and it is coming out through menstrual blood. So this is called as a menstrual phase. All right. First 14 days is called as follicular phase. Next 14 days is called as luteal phase. At this, in ovulation, it is called as ovulatory phase. At the menstruation, it is called as a menstrual phase. All right. So in short, menstrual phase, the first day of your cycle, the menstrual phase starts. It lasts for about 1 to 5 days, and the bleeding is usually heaviest in the first 2 days. Okay, then follicular stage. I already mentioned it keeps on increasing. The size of the ovum keeps on increasing. Then at ovulatory phase, the ovum gets released. And how do we know that you're ovulating? There'll be slight rise in the body temperature. Daily temperature, if you keep on monitoring from day 1, on day 14th, 15th, when you're ovulating, your body temperature will be slightly on a higher side. Let's say around 1 degree higher than your normal body temperature. And generally, normally you'll have a light vaginal discharge happening all 28 days. But during the ovulatory phase, the vaginal discharge becomes very thick and elastic, like it becomes like a glue. All right, then that you can know that you're ovulating in those 1 or 2 days. Then luteal phase, if the egg is not fertilized, then it is shed out and it comes out as menstruation, menstrual blood. So one more thing is, suppose you're having the cycle. I would like to focus one more thing. Generally, if I take 28-day cycle, then I would like to tell on your 14th day, you will have your ovulation happening. So that is the most fertile phase. So if you're planning for your pregnancy, that is the phase you'll have to plan. Suppose you have a 30-day cycle, then the last 14 days is constant. In any cycle, the second 14 days is constant. Suppose you have a 30-day cycle, you take off that 14 days. So you will be ovulating on 16th, 17th day, not 13th, 14th day. Suppose you have a 22-day cycle. You remove the 14 days, you will be ovulating on 8th or 9th day. So that is a fertile phase for your own cycle. So for every woman, the fertile phase is different. It is based on your menstrual cycle. The last 14 days is constant. So remove the 14 days from your normal cycle, then that is a day when you will ovulate. Other symptoms is increased rise of temperature and there will be thicker vaginal discharge. All these are symptoms of ovulation. So yeah, so before you have your period, some of us will be having some premenstrual symptoms like headache, mood swings, irritability. They'll have some abdominal pain, emotional disturbances. Every month, 1 week or 5 days before you get your period, all these symptoms most of us will be going through. So what to do with it? You cannot do anything about it. Just deal with it. Assure yourself. Self-assurance. Say this is normal. Every person is dealing with it. So you'll have to deal with it. So only thing you can do is meditate and have an active lifestyle, so that all these things will help you to relieve the symptoms to some extent. I can't tell completely, but maybe to some extent all these things helps. So apart from the premenstrual symptoms, you'll have menstrual symptoms like the period symptoms, almost the same symptoms, but in a aggravated form. You'll have uterine cramps, tender breasts, bloating, mood swings, irritability, low back pains, tiredness, headaches. All these are period symptoms. If you're not having them, well and good, lucky for you. If you're having them, then how do we deal with it? My advice is, please don't take the painkillers frequently, because you will get used to it and they might have some side effects on your liver and kidney. If it is unavoidable, if you have severe dysmenorrhea, then you can go for a painkiller every 4 to 6 hours. Something like a methylspas can help you. Okay. First thing is, you should eat properly, right food, take fresh veggies, fruits during your menstrual cycle, and keep yourself active. Maintain your general health, general hygiene, take a warm bath. And these heating pads also helps a lot. You can just take a hot water bottle. If you don't have this bags, you can take a hot water bottle and then just place that on the stomach area when you're resting. All these things will help you to manage your stomach pain. Apart from these, you can do meditation, some breathing exercises, some yoga asana, some mild exercises. All these things will help you to cope up with all these period symptoms and the premenstrual symptoms to some extent. Okay. Now coming to the menstrual hygiene. Why do we need a menstrual hygiene? Why is it important? Because it helps to prevent infection, local itching, and bad odor. And suppose you have a good personal hygiene, it will also keep you very confident during these days. Okay. Coming to the sanitary options, what we have. You have sanitary pads, tissue papers, cotton, tampons, menstrual cup, and cotton wool. I would like to discuss about each of these in detail and tell you what are the advantages and disadvantages of each. Before I go in there, how do we capture the blood? I'm sure everybody knows. Just want to tell you one single point here. Never ever insert anything into your vagina. Please, it's a request. Once you insert something into your vagina, be it a cloth or be it a, some kind of material, then you are just introducing the infections into the vagina. From the vagina, it goes up to the uterus. From the uterus, it goes into the fallopian tubes. Then your ovaries can also get infected. Then it goes into the pelvis, abdomen. It can cause serious infections. So please don't insert any material into your vagina. And always change the pad or the cloth or cotton or whatever you're using every 2 to 6 hours. Based on the flow you will have to decide when you have to change your pad. Don't allow it to soak. If it is getting soaked and wet, again there's high chances for infection. If your flow is very heavy, you can change it every 2 to 3 hours also. Okay, so these are the options available. This is the sanitary pad. These white things are called as tampons, and this is pink one is the menstrual cup. I know most of you will be using these. This is the sanitary napkins, because it is very easy, right? It is very easy. It is very absorbent, and so it provides a very dry feeling. Obviously, when it is dry, there's less chances of infection, easy to dispose, and it is helpful in mobility and easy daily routine. You can have your daily routine with the use of this sanitary napkins. So what if you're not using a sanitary napkin and you're using a cloth? I have a small problem with this sanitary napkin. There's a lot of plastic which is being used for the making of the sanitary napkins, and you just throw it on the road, and it causes a lot of environmental pollution, and it causes a lot of inconvenience for the people who pick up, right? And I just want to talk about alternatives to the sanitary napkins in my next slides. So if you're not using a sanitary napkin, what is the other thing which most of the people in India use? That is the cloth. If you're using a cloth, ensure that it is clean, soft, cotton, dry, and absorbent cloth. Suppose you're reusing it, please wash it very, very thoroughly and dry it in a proper sunlight. Okay, after drying, bring it inside, iron it if it is possible, and please store it in a clean and dry place. And please don't share this cloth with anyone. It is your private cloth. Okay, and after multiple uses, please dispose this cloth. If you're using it for 2 to 3 months and it got soiled, please dispose it off. These are the tampons. Tampons, these are the small, this white thing you insert into your vagina, and the string-like thing hangs out through your vagina. These things I generally don't recommend. Please use them with medical advice, because most of these tampons are made up of harmful, the ones that are easily available, are generally not so safe to your body. They have some harmful chemicals. It can cause some infections in your vagina or skin irritations, allergies, and all these things. If you're using a 100% organic one, then it is well and good. Seek the medical advice and you can start using it. And some girls, I know there are some girls who keeps using these tampons even when they're not menstruating, just to deal with some vaginal discharges and everything. Please don't use it without any medical advice, because it can cause very unusual vaginal infections, and again it can go to uterine cavity and ovarian infections and fallopian tubal infections. So please be careful when you're using it. And coming to this menstrual cup, I just want to talk in detail about this, because first thing, it is made up of silicone and it is reusable. Very, very important. It is reusable. It need not be disposed of. So automatically it is environmental friendly, right? So how do we use it? Only problem with the menstrual cup is you need expertise. You need to expertise the technique how we'll have to collect the blood. It might take you about 3 to 4 cycles to get used to. But once you get used to, I'm sure you will never shift to your sanitary pads. Because first thing, this cup thing you will insert into your vagina, fold it and insert into the vagina. And once it gets filled with the blood, you just remove it, wash it, dry it, and then you can reuse it. Store it carefully and you can reuse it. Okay, so it is very environmental safe, and it can be used for about 10 to 12 hours. You need not change it repeatedly also. And of course, plastic free. I mean, you're reusing it. So it is much safer to the environment when compared to the sanitary napkins. So when comes to pads and tampons, you use them, you'll have to dispose it, right? So how do we dispose it? Is it important? Yes, it is very, very important to know how to dispose these napkins. Please don't throw them in the toilets, especially the water closets, because it gets stuck, and then the entire drainage system gets stuck. Then somebody has to come. Then it is very embarrassing. You are spoiling the entire toilet because of your single napkin, right? So what best can you do when you're using a sanitary pad or a cloth or a tampon, has to be disposed? First thing is, you take a small dustbin, put it in the corner of your toilet. Once your napkins are soaked, please take it off. Please wrap them in an old newspaper or a waste paper, and then put it in the bin. You can just throw the bin once every day or once you finish your cycle. Suppose there is no disposal mechanism, you can just dispose it within your backyard by burial. You just dig a pit and you can put it inside, or you can burn it. That is called as incineration. But I'm sure you'll have a small dustbin with uh, newspapers available at home. So it is very easy and clean. Please don't leave them open, because it causes a lot of problem everybody. Okay, please don't put them in the sanitary toilets, or don't leave them open, because see, you can see all these street dogs pulling that, and it becomes a lot of problem to the municipality workers who are picking it up. See, the rag pickers also, unwrapped napkins, it causes a lot of messiness around. So why is it necessary to dispose it off if it is left open? First thing, it is not pleasant for the sight. First thing, then it causes a lot of transmission for the infections. Easily the hepatitis B and C gets transmitted, and it also attracts a lot of flies and insects. So this is a safe newspaper bag. You can make it at home as well. You just need some old newspapers, large old newspapers. Then take some glue, and a thread, make it into a bag, and you can nicely put your used napkins into it, seal it off, and throw it in the main dustbin. This is a environmental friendly and waste picker friendly way of disposing your napkin. Please follow this. It's very, very easy. It is your responsibility to do this. You should not leave your napkins, use napkins in an open dustbin, please. So what are the hygiene practices you should do during your menstruation? As I already told you, that you have to change your napkins very regularly if you're using a sanitary pad or a cloth. And suppose you're going out, always change your napkin before you're going out, and take extra napkins so that it is easy for you. And always wash your genital area each use of the toilet, and also after urination. And one more important thing is, when you're washing it, please wash it from front to back. Never do it from back to front. If you're doing it from back to front, the digestive system, the excretory products like feces, or the that once comes out from the anus, it travels ascendingly, like it comes in the front, and it can infect the vagina, or it can infect the urinary tract, and can cause a lot of urinary tract infections if you do it that way. So always wipe it from front to back. All right. And always keep the area in between your legs very dry. And when you're cleaning your genital area, please don't use all these harsh and harmful soaps, because it changes your vaginal pH. Vaginal pH is generally maintained. It has some useful bacteria which helps to fight the infections. Suppose you are cleaning it repeatedly with the soap, the pH balance get disturbed, and so the useful bacteria also dies off. So there is more chances of infections. Just clean it with a normal clean water. That's all. And I don't think you're restricted to take a bath every day during your menstrues. So please take a bath if possible twice daily and keep yourself clean. And please do not wash insides of your vagina with soap or any other product I already mentioned. What are the risks if you're not having a proper menstrual hygiene? I already mentioned all these things. Unclean sanitary pads, then there's more chances of infections. And wet pads, if the pads are getting soaked and you don't change them properly, the skin gets infected, it's broken, you get lot of skin infections as well. And if you're inserting, very important girls, please don't insert any material into the vagina. It causes very serious complications. And frequent drawing. Please don't force any liquid into the vagina. Again, it leads to introduction of bacterial infections into the uterine cavity. And the first thing, before all these things, you'll have to wash your hands before you change your napkin, before you start touching your genitals. First, wash your hands. Washing hands can almost spread all the diseases, all the infectious diseases, including COVID, which you are facing now. We can get win over all these infections if you just wash your hands with proper antiseptic properly. Okay. So how do we manage menstruation hygienically in an institution or in a community? First thing is you should have good access to the water for all the girls and women in the community. And there should be some private place or proper bathroom for the change of the sanitary pads or the cloths. If they're using cloths, they should have a proper access for the washing them, for drying them, and for storing them. And there should be availability of the clean water for washing the hands and used cloths. And there is also a need for the awareness for both men and women about the menstrual hygiene. Hello?
Yes, madam. You are audible, madam.
Shall I share my screen?
Yes, madam.
You can see my screen, Fani Garu?
Yes, madam. You are visible, madam.
Okay, I'll continue.
Yeah, madam. Kindly share your screen, madam.
Pardon?
Kindly share your screen.
Yeah, I'm sharing my screen. You're not able to see?
Yes, madam. I am not able to see your screen.
Okay, one second.
Didn't press here.
Okay, now you're able to see, sir?
Yes, madam. Yes, madam.
Okay. Okay. Sorry for that
Okay.
little disturbance.
Yeah.
Here, I'm sure most of you are using all these smartphones. You can just download period tracker apps and know when your next period is coming. So that you can just plan yourself. You can have your sanitary napkins or whatever you're using in stock. Keep it in stock. Okay, and you can know when is your fertile window or when you're ovulating. You can plan your cycle if you have this period tracker apps. So do you know this guy? Now you're able to recognize. I think now you know who the guy is. Yeah, he's a real Padman. I'm sure most of you have watched this movie called as Padman. If you haven't watched, please go and watch. It is available on Amazon Prime. It's a beautiful movie. It is a biography about this legend. He is none other than Arunachala Murugananthan. Right? He's from Coimbatore. So what did he do? He invented a cheap sanitary pad making machine and made sanitary napkins available at a very low cost. Almost the cost of the sanitary napkin has fallen to one third of its original cost because of this machine. And he installed that, it is called as Jayashree Industries, and he installed those machines in almost 23 states in our country. Apart from our country, he introduced them into 7 other countries all around the world. So he's a pride to India. We have to salute him. And he was awarded Padma Shri for his invention. I request you to please go and watch this movie. Beautiful movie. You will definitely get connected. He saw his wife suffering from the problems of menstruation, be it all these taboos, social taboos, and she used to use ragged cloth. So once he saw all that, he decided that he has to do something to the society. And he set an example to all of us. So, in his own words, I used to wear sanitary napkins for hours together while doing my daily chores. That's when I found out being a woman is not easy. So, respect this man, remember him, watch this movie. That's a small request from my side. So it's very hard to be a woman because you have to think like a man, act like a lady, look like a young girl, and work like a horse. And periods don't stop for pandemics, right? You have a pandemic or no, you'll have your period every month, right? So you'll have to be prepared for your period. You should know what exactly is your period, have knowledge about your menstruation, menstrual hygiene. If you know about all these things, please educate your younger siblings or your neighbors or everybody whom you know. Talk about it, break the taboo, break all the myths, and please try to make India a better place to live in. And 28th May is celebrated as Menstrual Hygiene Day. Last but not the least, please wear your mask, sanitize your hands, and maintain social distancing and stay safe. If it's required, then go outside, be careful. Let's fight this pandemic together. Thank you for your attention.
One of our madam is asking the question uh, regarding the menopause. She wants
Yeah.
the symptoms and consequences of the menopause. Adilakshmi madam, Dr. Adilakshmi madam from Civil Department has raised this query.
Yeah. Okay. So first thing, menopause, there is something called as perimenopausal period. Perimenopausal period will start before your menopause. So it may last for about 2 to 3 years before your menopause begins. So that's when you experience a lot of psychological disturbances, physical disturbances, emotional disturbances, because there will be change in your hormone levels. Main thing is there's a lot of irritability. the women will go through a lot of irritability, hot flushes. You feel extremely hot all the time. You want your ACs on, fans on, and you those are all the symptoms of perimenopausal phase. And before you reach your menopause, these are the symptoms you might have. Some of them will smoothly pass through this. Some of them might need medication as well. And one more important thing is, because the hormones are getting low, the estrogens and the progesterone will fall once you reach your perimenopausal menopausal phase. There is more chances for you to land up in osteoporosis, because these two hormones, estrogens and progesterones, are very helpful to maintain your bones. So once there is decrease in these hormone levels, there are more chances that you might end up with osteoporosis, that is loose bones. Like your bones will become very soft. So you have to be very careful, and also use some supplements, calcium supplements, vitamin D supplements regularly, so that you will not have easy, or just trivial trauma. You might have a fracture. So all these things can be avoided. I hope I answered the question. Anything else?
Thank you, ma'am. One more. Most of the women are suffering from hormonal imbalance problem.
Yes.
And do you suggest any remedy to minimize such type of hormonal
First,
imbalance causes?
yeah, I prefer a conservative management in this case, because most of the young girls who come to the clinic, I see most of them comes for a scan, telling that, madam, I have PCOD. So, and I'm on treatment. So, is it resolved or not? Right? So, by the main cause for the PCOD is hormonal imbalance. So, how do we deal with it? First thing is, have a balanced diet and stop binging on junk food or processed food. Stick on to your traditional food, and eat lot of veggies and fruits, and try to avoid the processed foods. That's one basic thing. Second thing, you should have exercise every day. 1 hour brisk walking will help you to fight PCOD and to reduce your weight, insulin resistance. All these things can be fought with regular exercise. So instead of going for medical management, you can do it at home, conservative management, uh, and all your hormones will fall in place, I'm sure. Instead of watching Netflix, please go to the gym or please go for a walk.
Yeah, thank you, ma'am. One more question. Here, Hemalata madam is asking, at what age menopause symptom starts?
It starts based on your menopause. Suppose you have your menopause at 45 years. Some people will be having at 50 years. Some people will be having at 55 years. So let's say you might have your, it generally starts 2 to 3 years before your menopause, whatever age it is.
Yeah, ma'am. Thank you. One more also. Funny ma'am is asking that during the time of menopause, do we get skin problems or skin rashes, skin aches as such?
Not really. I have not come. But then your skin might lose the luster, and you might have some wrinkle problems, but not rashes. I have not come across. But you might have hot flushes, like your skin becomes really hot, and all the time you need to sit under AC or a fan. Not skin problems as such. You might have dry skin and all that, which you can deal with a moisturizer, regular or a higher moisturizing content moisturizer you can use. Venusia is something which I know of. It is very, very good. It is very hydrating. You can use that if you have dryness.
Yeah, thank you, ma'am. The participants are requested to post the questions. Yes, sir. The question is to Jagadish, sir. So some here one of the mom is asking that most of the students they lose hair during exams. So madam is specifying about her daughter. She loses hair during the exam preparation or such. So what are the measures and remedies we can take to overcome this?
Unmute, Jagdish.
If she wants, she can use biotin tablets, but usually the cause here is a stress. So she should be stress free. She should practice meditation and little walking before. And I suggested to use biotin supplements. Am I audible? Yes. It is only at the time of exams, right? Yeah. The ideology is only stress here.
Sorry sir, we cannot get you. You are not audible.
Am I hello? Hello?
A little bit louder sir.
Yeah, the mic is the issue here. Yeah, the cause of it is stress here. So stress will relieve majorly, and only during exam preparation, she said, right? I suggested to use biotin supplements for hair fall. Am I audible, madam?
He's
No sir.
saying we have to use biotin supplements because the period is very short.
And Partha Sai Garu, natural remedies should be tried, but I don't say they are very effective for genetic cause of hair fall or stress-related cause of hair fall.
Sorry sir, we are not able to get you. You are not audible to us.
One second, I need to change it.
Any other questions related to menstrual hygiene? We'll discuss in the next couple of minutes.
Ma'am, one more
Yes.
question. Ramya has posted, what is the reason for irregular cycle?
Irregular cycles, again, what exactly she meant by irregular cycle? Suppose she's having it every 20 days or intermenstrual bleeding, or if it is getting postponed. So can you just elaborate on that? What exactly she meant by irregular cycles?
Ramya, can you specify the question?
Sri Ramya, if you're having a irregular cycle, I think based on your age, I think you're not having your cycles regularly. So the main cause could be a thyroid issue, or it could be because of your PCOD problem, mainly because of your hormonal imbalance. So please check with your doctor and rule out these two things: thyroid or thyroid imbalance or PCOD problem. If you don't have both of them, then uh, then I think you'll have to rule out other causes as well. The main things are thyroid and PCOD for irregular cycles. Okay, you're having okay, you're having uh, delayed cycles. I got your question now. So if you're having a delayed cycle, let's say if you have your cycle every 40 days or 35 days, it is quite normal. You don't have to get worried. Suppose you're not getting your period for almost 2 to 3 months, then you could have a problem with your hormones. Please get them checked and get it treated. Suppose it is PCOD, you can concentrate on your diet and exercise. That is quite helpful for most of the patients who comes to me. Apart from medicines. Okay. Okay, the hair questions. We'll go to the hair fall questions and remedies. One second.
So earlier it was a question from Fani Kumari madam. Said that your daughter is losing hair at the time of exam preparations, right? So the major etiology of the hair fall here is because of the stress. So the main remedy here is relieving her stress. Like you can ask her to practice meditation, or you can ask her to relieve her stress by having good adequate sleep and good exercise. And I also suggest her to take biotin supplements for this. It prevents excess hair fall. Okay. Thank you, madam. And Partha Sai Garu has asked if natural remedy works. Natural remedies actually, they prevent the hair from becoming thin. They maintain the texture of the hair. But nothing works for a genetic hair loss or stress-related hair loss. You have to go natural remedies, stopping hair due to hereditary. Hereditary hair fall cannot be treated with any remedies. You have to go with hair systems or transplantation. All these medicines are not effective if it's hereditary. Thank you, sir.
Participants, if any more queries are there, please kindly post it in the chat box.
Shampoo office, Sahiti Vemula Garu, which shampoo is best to get rid of dandruff? I've shown you scalp shampoo or Nizzerol. They're better. Use it twice a week at least. Nizzerol or one second, I'll share the screen. Yeah, can you see the screen, ma'am?
No, sir.
Then I'll write in the comments. Yeah, the scalp shampoo or Selsam on Nizzerol. Anything can be used for dandruff. Is the screen visible, ma'am? Ketoconazole shampoo, scalp.
No, sir.
Okay,
Yeah,
I'll type
now
in
it is visible. Now it is
yeah.
visible.
The scalp plus is better, I suggest.
Any more queries? Thank you, sir.
Thank you, ma'am.
Yeah, on behalf of Women's Cell, Prasad V. Potluri, Siddhartha Institute of Technology, staff and students, it's my pleasure to propose vote of thanks. First, I would like to thank our resource persons for sparing their valuable time out of their busy schedule. They have enlightened us with the insightful lecture and have enriched us with many health tips regarding how to overcome hair fall, what type of shampoos, oils we need to use, and what are the precautions and measures we need to consider for a safe menstruation. So they have given us many health tips to make ourselves fit and healthy. So thank you, Jagadish sir and ma'am. I propose my sincere thanks to our management and our principal, Dr. K. Sivaji Babu Garu, Chairperson Women's Cell Dr. P. Adilakshmi Garu, and Women's Cell coordinators for their grateful effort behind organizing such useful and helpful sessions. Finally, I am thankful to all our participants for their presence in making the session fruitful. I thank one and all for giving me this opportunity. Thank you.
Thank you, ma'am.
Thank you.
Bobby, congrats.
Hello.